Hello everyone, and welcome to another episode of Ask Dr. Bob. And we have a new fan that said just recently found us, and she had a very significant question. Her sister has been to many neurologists and doctors that deal with the nervous system. Her sister was diagnosed with something called global ganglia, and that has everything to do with her body's inability to move properly. She's in a wheelchair. So I'm going to throw a few ideas out to you right now. Stress depletes or lowers the pH in a person's body. When your pH is low, your body uses up a lot of minerals. I learned from tissue mineral analysis of hair that when somebody has an acid pH, which often shows up on a hair analysis with low manganese and selenium, they'll have low thyroid function due to low TSH, which comes from your pituitary. You might say, Dr. Bob, what did you just say? An acid pH can stress the brain, because if the pituitary cannot create TSH and the thyroid's not working, I'm not saying that this is the answer also for this individual. In our practice, we have a video x-ray machine. We know that this part of the neck here has everything to do with the lower part of the brainstem and the neck. I would encourage you to have that type of film taken. We also have practice members do a test with their eyes closed, and we have a march, and they should stand in place. And for those of you watching me from around the world right now, you could do the standing marching test. And if you're not at the same spot at the end of your test, you may have some involvement of your upper neck. This question came from someone from Empower Her. Very concerned about hot flashes and my comment about using iodine. I want you to know this. There are many reasons for hot flashes. Could be adrenal gland exhaustion, not enough oil. Commonly we find subpar or not enough iodine. We always will do a TSH, a T3, and a T4 to check how the thyroid's doing. But exactly the best way to do is with a urine iodine loading test, and then we supplement accordingly. So yes, hot flashes can be helped by iodine, but that is not the only reason. There are many reasons to have hot flashes, and I wrote an article about that. Someone wanted to know about iodine and Hashimoto's, which is an autoimmune problem associated with the thyroid gland. We don't necessarily use iodine for Hashimoto's. We encourage our practice members to get off of gluten and sugar, but we've had success with selenium. We also use various forms of vitamin E. Dr. Bob, what spices do you use or encourage? We use Celtic sea salt, and then with fresh ground pepper. This is very important, by the way. Fresh ground pepper has a trace mineral called molybdenum, and we find molybdenum deficiencies. And for those of you that have an MSG problem or perfumes and fragrances bother you, fresh ground pepper, and then we just have a whole bunch of herbs from our yard: basil, thyme, oregano, chives. You just have a herb garden that we use for our spices, which are herbs. Someone wants to know about left neck, left knee pain. Well, we usually find left neck is a pancreas referral. Now I'm going to throw a little thought to you that I learned many, many years ago. Discomfort on the right side of the body or right drooping lip. So look at your lips, and if your right lip droops, could be a potassium need. If your left lip droops, it could be a sodium need. And I learned that from a gentleman who is a naturopath. His name is Dr. Lepore, and it was just something that I learned along the way. So here's another question that somebody wanted to know about fatty liver. They had a lot of questions about fatty liver, and we could talk hours about fatty liver alone. I would encourage you to get off of all fruit. Watch your medications you're taking. We're seeing an epidemic now of young ladies in our office between 15 and 25 years old that have fatty livers, and I'm telling you, get off of fruit. Half an apple a day. Fruit is not the same as what it used to be. A lot of hybridization and changes there. They also want to know what kind of water filtration I use. I use a reverse osmosis unit. At one point I used a Kinetico. I know recently we just put a new unit in our home that we have as a General Electric version of a reverse osmosis unit. You may want to watch this over again. There are a lot of really wonderful questions. We appreciate them. Go to YouTube and type in my name and just search around for different types of videos that we'll have available to you. Thank you so much. I'm Dr. Bob DeMaria.